Hello, Facebook. Welcome to this Facebook premiere. I'm Rob Howe. I'm the host with the most insulin on board, and I'm very excited to introduce you to the Acquire Some Knowledge campaign from Medtronic. Throughout the past few months, Medtronic has been digging in with experts and ambassadors from the Medtronic family, and we are talking about acquiring some knowledge because ethnic minorities with diabetes are 3 times less likely to use diabetes technology. So we're digging into conversations about why and trying to normalize the conversations around the use of diabetes technology in minority communities. And the main reason that has been identified is an awareness gap. And so we want to deliver information so that patients feel confident to ask questions and advocate for themselves with their HCP and their care team to help close that awareness gap. Medtronic is committed to shining a light on this by encouraging people living with diabetes, but especially ethnic minorities, to ask these questions with their care team and in the community. So I have 2 very special guests with me today. I have Dr. Lashelle Barmore and I have Kris Leeper, Medtronic ambassador. And I'm going to be spending some time with you guys today, asking you some questions, having a little bit of fun talking about diabetes and technology, because I can already tell the 3 of us nerd out big time over diabetes tech. So I'd love to let you guys introduce yourselves. And Dr. Barmore, how about we start with you?
Absolutely. Good evening. It's such a pleasure to be a part of this great conversation. I am Dr. Lashelle Barmore, a board certified family physician that practices out of Birmingham, Alabama. I am a diabetologist, and about 85% of what I do is diabetes management. I'm also a type 1, have lived with diabetes myself for the past 36 years, and I'm just happy to be here.
Well, we're happy to have you. And I'm always excited to talk to HCPs who live with diabetes, so we're definitely going to dig into that a little bit later. But Kris, how about you introduce yourself?
Yep. Hey guys, thanks for having me. My name is Kris Leeper. I've been living with type 1 diabetes for the past 8 years. Been using pump technology for the last 4, and MDMIs and pens before that.
Great. Well, we're excited to have you here. And it would be foolish of me to not admit that I also live with diabetes and have had type 1 diabetes since 2005. So for those keeping track at home, that's 16 years. And I'm currently on the MiniMed 770G system, which I started this year. So let's dig into it. Let's talk a little bit about the barriers that people are facing with diabetes and access to technology. So Dr. Barmore, can you share a little bit about what those barriers are when it comes to technology, and what you see is the reason that technology can benefit people on insulin who live with either type 1 or type 2 diabetes?
Absolutely. I think just like you mentioned, that it's such a struggle from the perspective of access and even a knowledge point. I think that a lot of times we're very familiar with the old school, so to speak, MDI regimens. And I just find that a lot of my patients are completely unaware of what pump technology can do for them. And, it's becoming more accessible through some of these types of mediums. But I think that patients just don't know is a large part of it.
And that's something that really resonates with me because I'm a diabetes social media person. So I interact and have conversations online with people with diabetes. But I know, because I see the numbers, especially in the United States, of 1.6 million people with type 1 diabetes and dramatically more with type 2. And I don't see those people interacting online. Is there a stigma about sharing your life with diabetes in some of these communities that's preventing people from getting the information that they need?
Absolutely. Sorry about that, but you're correct that there is a huge stigma. And I think as a result of that they don't necessarily seek out some of the newer technologies because they felt like that someone told them that diet and exercise alone should be enough. And why can't they get it together? And I think it's a tough place for a patient to be, to feel like that my doctor or, anybody in that regard doesn't feel like that I'm doing the things that I really should be doing. And I think that we've got to kind of get out of that mindset that diabetes is all the patient's fault. And I try to even give that to my patients. And I do really feel like that we've got to screen more, but when I talk to patients, oftentimes I do tell them that we do need to be diet and exercising, but let me sometimes shift some of the burden and figure out what else we can do to help manage your disease state so that you don't feel like everything that is going on with you is certainly self-imposed.
Kris, can you share with us a little bit about how you use technology to help manage your diabetes?
Yeah, for the first 4 years of my diagnosis and living with diabetes, I did not see or experience an insulin pump. I didn't know what one looked like. I thought it was something totally big that was going to be attached to you for the rest of your life. And at the time, I was more active, played in sports leagues and, hanging out and stuff. So I was like, there's no way I want something attached to me 24/7. I don't want to do it. I don't want to even hear about it. Like, I was just told like, hey, there's insulin pumps, but I didn't know anything else about it. I left the hospital after my diagnosis with a vial of insulin and needles and a prescription for insulin. And I was basically told to check your blood sugar at least 4 times a day, but probably up to more about 7 or 8, as you kind of get familiar with it. But then you should inject insulin daily, and that's your lifestyle for the next until you die. And that's what happens. So for the first 4 years, I was just doing injections. I was just carrying around insulin in a lunch bag, insulated lunch bag, and I carried it around everywhere I went. I left it in hotel refrigerators, mornings of flight. I've left it, at work before, and I had to go back at work because it was just something that I had to bring with me all the time. And I wasn't always thinking about it because I was trying to live a normal life. So going through that process, it really weighed heavy on some of my decision making that I was making, managing my diabetes, and it made me hate my diagnosis. Like, I couldn't live my life that way because it was just so hard to try to remember how much insulin to take, and then also how to manage, carrying this stuff around all the time. And it was just so stressful. So with technology, it's allowed me to release that burden that I was literally carrying day to day through my normal activities. And, it's something that I could really manage and benefit from just carrying it from place to place.
And I think stories like that, like your diagnosis, leaving the hospital with just insulin syringes and a prescription. You and I were diagnosed, not exactly, super close ages, but close enough. On day 1 of my diagnosis, I was told about insulin pumps. They told me I couldn't get one yet, but that was probably in the path for me as a young active person with diabetes. And so in my mind, it was planted that this was probably going to happen and be something that I explored. And I was very much like you at first. I didn't want anything on me. I thought it had to be surgically implanted, and I learned later. But my doctor and my care team brought the technology back to me and engaged with me on those subjects. I wasn't seeking them out necessarily. They were asking me the questions and making me engage back with them on what I wanted and what they thought was best for me. And I think as we think about closing that gap where ethnic minorities with diabetes are 3 times less likely to use technology, I think it's in those initial conversations and just giving people the materials that they need. So what would you like to share, Kris, for people who are watching, who are living with diabetes, but especially minority groups, about diabetes technology? And like, what questions should they ask their provider? What questions, if you went back, what questions would you ask to your providers about technology, whether it be pump therapy or continuous glucose monitoring? What would you ask your care team?
That there's options out there, that I wish I knew there were more options back then. And we're only talking 8 years ago. But there were insulin pumps 8 years ago. There were insulin pens 8 years ago. There were different ways to manage your diabetes, and there's information surrounding your diabetes more than what you somewhat are being told sometimes. Because carb counting is another good example. I wasn't taught to carb count. I was just taught to eat less and exercise more, and I would probably feel a little bit better, but I'd still have to take insulin. I mean, that's nothing compared to what I know today. That's how I manage my life today as well. And it's just the more you kind of know, like technology has surpassed everything in this world and made it, either fine-tuned it or made an improvement. And the same thing with diabetes. Technology exists and it's been around for a while. It's been proven technology that can make you live a better life. And if not, there's other options that are available with CGM only and just knowing your numbers and having that access on your phone. I mean, there's options available. So it's not necessarily just tied to pen or pumps. There's technology all across the board to help you improve your diagnosis.
Yeah, I couldn't agree more. What's interesting to me is in 2005, when I was diagnosed, they told me about the technology that is available today. And they're like, in the future, this technology will be available and you'll be able to see your blood glucose on your phone, and you'll be able to have a continuous glucose monitoring hooked up with your pump, and they'll be able to communicate with each other. And now those things are on the market. So it's exciting to see technology, that graph kind of continue to increase.
Absolutely.
Dr. Barmore, we're talking about a disparity. We're talking about a large one, 3 times less likely to use technology. Why do you think technology is not being brought up to those people in these communities who are living with diabetes, type 1 or type 2? And what discussions do you think these patients should be bringing? What questions should they ask to acquire that knowledge from their practitioners and their care team?
Absolutely. And Rob, just out of the gate, it absolutely breaks my heart to hear those types of statistics, and understanding where and why it is, I think, is a huge part of how we work on fixing those disparities. And a lot of times I think that there are biases that we all carry that we just have to kind of confront. It's interesting to hear you all's initial diagnoses. Now, mind you, I'm a dinosaur in comparison, but even from my own aspect, I was pretty late. Like I said, I was diagnosed at 85, and in 2000 was when I actually started insulin pump therapy. Now the technology has drastically changed even from then, but again, it wasn't an initial conversation. It wasn't even a conversation that I was really offered. It was on my own mentioning, hey, I've seen these pumps. What do you all think about it? That I was able to get started on my own insulin pump therapy. But I'll say this from the perspective of, I think that there's multiple reasons that this occurs. And the number one reason is that I feel like that it's acceptance, that I think that there's some bias that ethnic patients may not be as receptive to some of the therapies because they may be new to it. But, I like to think from the perspective of if we look back, and again, I continue to age myself. When I was in high school, nobody had cell phones. Where it didn't matter what ethnic group you came from, nobody had a cell phone. And eventually, everybody has a cell phone. You know what I mean? I don't know too many people at this point in time that don't have a cell phone or some type of smartphone, so to speak. And thinking about the technologies that we have, it's very akin to smartphones. And to think that maybe because a group has not necessarily been privy to access doesn't denote that they can't do it or that they're not going to be willing to accept it. Because I like I said, having a phone with you everywhere you go seemed weird in the early 90s, but now it's a part of our lives. And I think that just recognizing that just because it's new doesn't mean that it won't be accepted. The other piece too is that I think that financial burden is a part that maybe as healthcare providers that we don't completely understand. And I think that technology seems to be the more expensive route. And, I don't want to get into too much of the weeds, but there's actually good literature out there that shows that pump therapy is, and some of the other technologies that we use are equivalent, if not cheaper, than the options that we've had in the past. And thinking about lost days at work and sick days and all of those types of things and hospital bills that come along with complications, I think that we've got to present it for what it is. That yes, it's not always the right in front of your mind cheapest technology, but it's significantly improved, and overall costs generally are not such a barrier. So I think it's more just confronting what our undisclosed biases are about certain ethnic groups, that as even healthcare providers, we got to move past that. I think that it is our duty to make sure that we're offering the most effective, the best regimen for our patients that's possible, regardless of what we think their acceptance of it may or may not be. From my own patient perspective, in both the type 2 and type 1 space, I feel like that we have learned so much more using continuous glucose monitoring. If you are a patient living with diabetes, there's really no reason that I don't want to see your sugars all the time. So why wouldn't I offer you those types of things? And then even in pump delivery and things of that nature, it's like, I just want to give you the options. I want you to know what is out there and help you to make a guided decision about what's going to be best for you, and not putting forth my own biases about what I think you're going to do or what I think is going to fit you best, or what I think you can afford. So I just feel like, tell them what's out there, let them see it, let them touch it, and let them make that decision. And I think that even healthcare providers would be surprised at how much better it's accepted and how much better we do as a community by really giving them the tools that are necessary to manage well.
Absolutely.
I totally agree. And I think an interesting thing that I want to tack on to that, Dr. Barmore, and sorry for cutting you off, Kris. When you look at the outcomes and A1C outcomes specifically in these different patient ethnic groups, when we're talking about minorities are 3 less likely to use technology. And again, I'm not a researcher. I'm a notable internet person. So I've got to make sure that you don't take my advice. But as I look at those numbers, I believe that there is some sort of correlation between the lack of adoption with diabetes technology and the A1C outcomes long term, which contribute to complications, as you mentioned. And you mentioned as well, a life with diabetes is long and occasionally can be very expensive down the line. And if there's work to do up front where there's a little bit of a financial investment that can impact significantly the outcomes long term, I guess I'm putting you on the spot here. Am I onto something here? Is there some sort of correlation between the 3 times less likely to use technology and overall A1C outcomes?
Absolutely. I think that you hit the nail on the head. Again, I'm just a clinician as well. I don't love to do the research side of things, but you're absolutely correct. I mean, we can see that just in our day-to-day lives and seeing what, when patients come in, the patients that are utilizing the technology are doing far better. And I would like to even at some point look at those numbers within my patient practice. Of course, I think that it's easy for minority patients to seek out minority care. So I do tend to take care of a very African American Hispanic population. And as a result of that, I'm sought after from some of the insurance companies that show my A1Cs are better. And I'm not magic. I'm using the same medications that everyone else is using, but I'm offering that technology. And also I think that just, giving them the side that I'm not going to beat up on you. I'm going to be your cheerleader, not your coach. Or maybe your coach a little bit, but at least a nice coach. But, that's it. I use the technology, and the technology aids patients in getting the results that we as clinicians are looking for, but also allow them to feel well. I don't think that's the piece of it that bugs me so much, that, this is not just a numbers game. People don't feel well when their sugars are high, and if we can do anything to make those numbers be better so that they can feel better, then I think that we're doing our job.
I want to focus on one thing that you mentioned. When you mentioned that a lot of minority patients come to you and they seek out care teams that represent them. When you are introducing a patient for the first time and tell them that you use diabetes technology to manage your diabetes from a patient to patient perspective, do you often see the lights come on for them? Is it often the first time that they've been either exposed to it, or they see that, oh, maybe I can use this device because you are the example?
Absolutely. And I probably am more of an open book than I need to be at some point in time, but I'm never ashamed to say, hey, let me show you what my CGM looks like, and if God forbid it's time to change it, I don't mind changing it in front of them. Let you see what it looks like. If I'm showing them my pump now, I got to be careful about the areas that I'll show. You know, I'm a mom of two. There's some things I don't want them to see, but I certainly don't mind letting them see what my infusion set looks like. You know, and the fear about the cords and things like that, I'll tug on it. I'll let them tug on it and see, you know, that this is something that is absolutely doable. And they look at me and they feel like that from looking at a physician that's living with it, that certainly there's a bit of a belief system that I'm doing what I'm supposed to do, right? Not that I always am, but they look at me and they say, well, she don't look like she's doing that bad. Or, you know, maybe she didn't mess up so bad that she had to get a pump. It was the choice that she made that she wanted a pump, or she wanted the CGM. So, you know, seeing me do it and seeing what it looks like on me and seeing what it is in real life, you know, I think that kind of helps them to be comfortable with it as well.
I've definitely seen that and heard that from members of the community as well, of how important it is to be able to talk to your doctor from at that level and understand, you know, and allow to ask those questions. Kris?
Yeah, the biggest takeaway from both you guys is like Rob, you mentioned it, like making that initial investment up front, because diabetes is not going away. You can't take a nap and wish it away. You will deal with this for the rest of your life. So getting serious, asking those questions and understanding what works best for you is the best option for you to live a better life. You know, diabetes from my standpoint, I thought it was a death sentence. I thought it was, hey, I'm going to live this for a little bit, a few years, and I'm going to die. But it's not that. I live a normal life. I live a life where, you know, I was before by diagnosis and I'm able to do the things that I was doing before. And it's not a death sentence. I'm living proof, and you are too. And Dr. Barmore, you guys are living proof that you can have diabetes and live a normal life and be the best version of yourself. So knowing what works best for you and asking those questions from your physician and your team around you is perfect. You know, it's a perfect opportunity to segue to live a better life. Because like Dr. Barmore, she says that you don't feel good when you're high or low and all the time, and you don't. And technology can help you manage your diabetes to prevent those highs and lows sometimes. So there's times where it'll be on your control. It's just the diagnosis. But if you have the answers, you have the questions that you ask, you can help narrow the scope and do better. You can get better.
And if you don't mind me adding to that as well, that, you know, I think that another piece of how I work with my patients is that I'll ask them, you tell me what you can do and let me give you the aids to move through that. I think about how many patients have received MDI, and as a physician, I tell them, okay, so at night, you're going to take this. And with every meal, you're going to take this. But if it's this, you do this. And if it's that, you do that. And the patient nods their head and says, okay, I got it. And they walk out of there and there's no way I can do this. And I think that a lot of times if we slow down enough to say that's a lot, it's a lot. And granted, we do need to be well versed in how to manage MDI going on insulin pump therapy. But at the same time frame, I think that it is huge to say, all I'm going to need you to do is check those sugars, however you're doing it, and press the buttons. You know what I mean? And I think that's a whole lot simpler than making sure that they understand every nuance of what each insulin is addressed to do. And ask them, what can you do? What do you want to do? What makes sense for you and your life? You know what I mean? So I think that those are the questions we need to be asking patients. And even as patients, be honest with yourself. If taking 4 to 6 shots a day is more than you can handle, then guess what? You could be a candidate for a pump. Like, you know, don't be afraid to say, this is too much.
Yeah, just to add on to that, yeah, I felt that too. And sometimes I go to the doctor and they say, do this, do that. And I do that and I do this. And it still didn't work. And I was like, well, what if you told me to do this? I'm doing exactly what you told me to do. And it still doesn't work. And it's not the fact that they were lying or misinformed me. It was just where the details is what we're missing. So they weren't with me when I had a stressful day at work. They weren't with me when I had a terrible night's sleep. They weren't with me when all this different factors were affecting my diagnosis and causing these things to happen. And I didn't know that at the very beginning, so I didn't ask the right question. So yeah, ask the right question. Tell them like specifically, hey, I had a bad day when I didn't get enough sleep the night before and I had to work 16 hours. I mean, those are real life scenarios, oftentimes where you need to have a real discussion with your doctor. Is tell them your lifestyle, tell them what you struggle with, so they can help, weed through the details to give you a therapy and some tools to help you diagnose your diabetes a lot more. Because like you said, you go to the doctor, you don't talk about stress levels, you don't talk about work, you don't talk about, kids, you don't talk about any of the things that go on in your normal different life. You just talk about things that the major milestones. So you eat, you sleep, you wake up, that's stuff that we're expected to happen. What about the unexpected stuff that comes up?
Definitely. And I think it's so dependent on lifestyle, right? And I think that is where conversations about diabetes technology on a broader spectrum with more people can help influence outcomes. Even just like you said, Dr. Barmore, feeling better makes a huge impact. And the impact that can have on someone's career, on their family life, on their goals and dreams and aspirations. I think those are the things that aren't included in those research numbers. That with that ethnic minorities, three times less likely to use technology. Imagine the amount of good days that could be added to those patients' lives if these conversations continue to happen or can happen at a broader scale. Even at this just sort of proof and point, I felt myself my hands getting a little sweaty, and I was able to, in the middle of my meeting, just look down at my pump and see that my sugar is dropping, and that's probably why my hands are getting sweaty. So just a case in point of a great way to integrate diabetes technology into your lifestyle. So I do want to thank you guys, Dr. Barmore, Kris, Leeper. Thank you guys so much for being here today. Thank you for participating in the Ask campaign. Thank you for everybody tuning in. And I hope you acquired some knowledge from today's event. And if you want to learn more, you can visit medtronicdiabetes.com for important safety information and to learn more about Medtronic. Any comments that weren't answered during the Facebook Live, I know our team is down there answering as many questions as possible, but if they weren't answered during the live event, they will get back to you soon. So be on the lookout and check those notifications. Thank you guys all for being here today, and we'll see you again soon. I'm Rob Howe, and you guys have a great rest of your day.